to another video series. I'm Dr. Scott Whitten from the Nevada Center for Reproductive Medicine. I'm going to talk to you about a hot topic today, which seems to come up quite a bit in the media, and we're seeing more and more patients in the clinic that are requesting fertility preservation options. And what that means is, how can I preserve my fertility potential for the future? Is there anything I can do now to preserve that? And the answer is yes, there is, for the right patients. So originally, fertility preservation came into play when we were looking at patients who were diagnosed with a cancer diagnosis, and they were planning to undergo chemotherapy treatment that would have potentially rendered their ovaries empty of eggs or void of eggs, because the eggs could all get destroyed because of the chemotherapeutic agents. Now, what we would do in those cases is we take some eggs out of their ovaries and freeze them, and then they could undergo their treatment. Hopefully they get cured from their cancer. That's our ultimate hope for them. But then afterwards, when they are cured and they're looking at their family planning again, they could come back to the clinic. Even if they didn't have any eggs left in their ovaries, they could use eggs that they had frozen to create embryos and pregnancies. Now, there are a lot of women who are trying to preserve their fertility potential for the future because they just are not in the right situation to build their family yet. And they're worried about age, and they're worried about their egg numbers going down. I'll refer you to a previous video that I did talking about ovarian reserve assessment. Egg numbers are really important, and if they're going down with time, there are some women who maybe are in their mid-30s who are thinking, gosh, I just am not in the right place right now. Maybe I should collect some eggs and freeze them, and that way I have somewhat of an insurance policy there for the future in case I need to use them. Maybe you don't need to use them. Maybe next year you meet Mr. Right and you're in the right relationship, you get pregnant and you don't need to use those eggs. But they're there if you do need to use them. And because when eggs are frozen, they don't age at all. So all the eggs that are aging in your ovaries, these are different. They've been preserved, and that is the major benefit of preserving eggs and freezing them. So if you want to learn more about egg freezing, you have questions about it, success rates, how many eggs would I be able to freeze, is my age appropriate to freeze eggs, any of those questions I think are very important questions. If you have them, you'd like to learn more information, please call our office, call a fertility center near you. You need to get that information, and because it is time sensitive, you probably should get it sooner rather than later. Thank you.